Hi, everyone. Welcome back to the channel. This channel is to provide support for people with chronic daily pain. I had an epidural done 5 years ago for a herniated disc where the doctor punctured my spinal cord, causing adhesive arachnoiditis. I know there's some of you that follow me that have that condition, and there's others that follow me that have other multiple conditions. Since that time, I've been diagnosed with fibromyalgia because of the nerve pain. I also had osteoarthritis before that. And so I want to talk today a little bit about doctor's notes. Now, I'm a former nursing home administrator, a career nursing home administrator. I've been over nurses and supervised them. I've worked with doctors, pharmacists, and all kinds of medical providers. And I know that your doctor's notes can be very important. And a lot of us don't even know what they say. So many times now we have patient portals that we can tap into where we can look at our doctor's notes almost in real time. Now, I've worked with some doctors that don't even post notes for 30 days. And I know in the back of my mind, how are they going to remember everything we talked about or get everything correct 30 days from now? They're not. And that's why it's so important for us to review our doctor's notes. I've had this happen to me 3 different times that I have had to go in, read my doctor's notes, and then request that they fix my records. And this is why it's so important, because other providers are getting copies of our medical records when we're going for treatment. And it can give them an idea of what we are like, not only medically, but as a patient. And they can put in there that we're uncooperative or that we don't follow recommendations. They can put a lot of things in there that can hurt us then when we go on to see other providers. I want to give you some examples of what happened to me that I've had to get corrected. One of them was with a physical therapist. I had a fallen arch. It was causing me Achilles pain. I already have nerve pain from having adhesive arachnoiditis. I already have involuntary movements, long cramping and consecutive cramping that happen at night and during the day. I have muscle spasms. I have all kinds of side effects from my adhesive arachnoiditis. So then when they sent me for physical therapy for my foot, I was very scared. I didn't want it to set off more symptoms that I already have from my nerve damage. And after 8 to 9 weeks of going, it did cause me extensive further symptoms. I had repetitive long cramping at night in my feet and in my shins and in my calves, cramps that I could not get to stop. And as soon as I would get them to die down, they would start again. And it was from the very minimal exercises they were having me do in the office, picking up marbles with my toes, getting up on my toes and doing heel lifts and toe lifts on wedges. It was very, very minor, but it was setting off all of my nerve reactions because my nerves misfire all the time. And I never know what kind of day I'm going to have, what kind of hour I'm going to have. Most of the time, I operate at a 7 or an 8 pain level on a scale of 10. And that is a normal day for me. So when this continued to happen and my Achilles was swelling from these long cramps I was having at night, and I was getting worse, my physical therapist said, I'm doing you harm and I do not want to do you harm. I'm making this worse for you. I'm going to go ahead and tell you not to come back. I agreed with her because it was terrible. I was getting no sleep, and these cramps continued and have continued even though I stopped going to therapy a year ago. I'm still having the same cramps periodically where like one toe lifts up, which was some of the exercises she was having me do. I still have some lingering problems from those 8 to 9 weeks of therapy. But when I got those notes, they said that I chose to quit going. And that was not what had happened. I agreed with her that I should quit going, but it was her idea for me to quit going, and I had to ask her to amend those notes. The second example is I was paying for lidocaine shots in my back for pain, and I paid $1,200 up front to get a set of 12 shots. I was trying to stretch these out because I had to pay for them out of my savings. Insurance would not cover them. Well, this lady that was giving the shots, she was giving a lot of people these shots, and we relied on her, and she left the practice. They didn't want to tell us that she left the practice, and I kept calling trying to get in, and I couldn't get in. And it took me almost 3 months to find out that she had left the practice. And they told me by this point I would have to go an hour to get shots from another provider that was in their program that was only at the office 1 to 2 days a month because she worked full time somewhere else. And by this time, I was in too bad of shape to even drive myself an hour to get shots in my back. So I had to wait for a day she was in the office and a day that my husband could take me to get the shots. Well, she did not know how to give the shots like the other lady did. She didn't understand the trigger points, and the shots she gave me had no effect. I could barely walk on the day that I went in there. I was in so much pain, and I got no relief from the shots. I had one set of shots left. She was coming to a nearby practice on another day in the next month, and I thought I'm going to go ahead and just use it up. I don't have high hopes because she didn't do a real good job the last time, but I thought I've already paid for it. I'm going to go ahead and go in. I'm no better. I need some relief. So I went in, and I normally would get 6 shots. On this day, she gave me 2 for my $100 instead of 6. And needless to say, they did not work. Well, then when I got my report and looked at my doctor's notes, she put that I was in bad shape because I had waited too long to get my shots. And she also put that I was progressing and that I was doing better, and that I had reported a 6 out of 10 pain scale. I can't even remember the last day I've had a 6 out of 10 pain scale. I would love to have a 6 out of 10 pain scale, but she put in there that her shots were making me better, that I had reported progress. This was not true at all. And I had to call her supervisor and have him talk to her to get my notes rewritten. So this was another example of staying on top of your doctor's notes, because what they put in there can make a huge difference when they're putting that you're progressing and you are not even feeling better and can't even walk after you leave or the days following. That is just plain not true. And I was very, very emotional and upset when I read this, when she put that I was doing better. I have a progressive, persistent, long-term nerve damage. This is not going to get better. I never report that it gets better, but that's what she put in her notes. The third one came from the doctor that waited 30 days to make a note in my chart. He put in there that I'd been unable to work for several months because of my condition. Well, I have had this condition for 5 years, and I trudged through it for 2.5 years, and I haven't been able to work because I'm in so much pain. And we talked about all of this, but even though that seems like a little thing, it is important when you are seeing doctors because you are in pain or you are having repetitive problems, and they make it sound like it's a problem that just started when it's something that's been going on for years. That's imperative to your care. So make sure that you are reading their notes. I asked for him to update my notes and make them correct, and he did a correction in my notes. Most of the time, they will. I have not had them say that they won't. A lot of the times, it's just because they're waiting too long to do the notes, or they're copying and pasting from another visit that might not even be you. When I read the notes from the gal that did the shots in my back, I read this and I thought, who is she even talking about? Because it doesn't even sound like me. I think she's just copying and pasting from something that she uses all the time for all of her patients, because it certainly didn't describe me. So I just wanted to put this alert out there. If you're someone that has not looked at your doctor's notes, make a point of asking to see them or getting copies of them or making sure you're signed up for the patient portal, because you might just be surprised what they say. Thank you for listening today. I look forward to reading your comments. I appreciate you tuning in, and I hope you're having a low pain day.